welcome to Integrated Spine Pain and Wellness. I am Nikki Goyle, and I am here with my husband, Dr. Ashu Goyle, and this is our pain perspective. So today we are going to be talking about pain after you have a knee replacement. Now, a lot of patients who come in, if they have had a knee replacement, they think that their pain issue is going to be solved and it's going to go away. But there are a few patients that do receive pain or have pain after a knee replacement. So today we're going to talk with Dr. Goyle, and he's going to tell us basically why this happens, what are some of the symptoms, and what you can do to manage the pain to get you back to your regular way of life. So Dr. Goyle, this is interesting to me because I am one of those people that would think you have a knee replacement, all of your issues are solved, and you can get back to your regular daily activities. But you're saying that there are some patients who actually have pain after their procedure. So can you tell us about that?
Sure, exactly. So like anything in medicine,
Yeah.
some patients respond to treatment, some people don't.
Okay.
That's just the reality of what we deal with. There's an individual component that I just think that it gets so complicated that you can't always just generalize. Right?
Okay.
Most patients who have a total knee arthroplasty or knee replacement, they do very well.
Okay.
I think the bad outcomes happen. It's not even about bad outcomes, really, because the hardware can be perfectly in place, but for factors we don't fully understand, the
Okay.
pain persists. All right.
Can I interrupt and ask a question? I'm just curious because my wheels are turning. Does weight have an effect on this?
Oh, for sure.
Yeah.
Yeah.
So
Most surgeons.
because like when I think about weight, I think of it just, if there is extra weight that is putting extra pressure on that knee. So I'm just curious.
Yeah, so there are a lot of factors. I'm not an orthopedic surgeon,
Okay.
but obviously I'm not an orthopedic surgeon. But I think patient selection is a big factor
Okay.
in having a positive outcome. That's with anything we do. Even when I do my own procedures for my pain patients,
Okay.
I choose which procedure is appropriate for that individual patient.
Okay.
It's
So
not
everything
one
is
size fits all.
customized.
Exactly.
Okay. Got
and
it.
so most of the orthopedic surgeons I refer to who perform this procedure are very strict with their criteria and patient selection. But getting back to the weight, I think the stat is for every pound of weight, it equates to 4 pounds of pressure
Oh,
on
wow.
your knees.
Okay.
Yeah, so that's why weight loss is very important, especially when you're
Interesting.
considering a knee replacement.
Yeah.
I know many surgeons have a cutoff weight limit.
Okay.
Just because they want to optimize outcomes, and that
Okay.
makes complete sense. And also, I think there's a motivational factor afterwards too. And unfortunately, with surgery, the anatomy can be fixed, but then there's a rehab and recovery period. And what I'm seeing in my practice is the patients who do the aggressive physical therapy afterwards and stick to their regimen tend to do really well.
Okay.
So I have several patients that monthly have knee replacements.
Okay.
And they tend to do really well. But the
Okay.
ones who don't, there's a lot of factors that can influence that.
Okay.
Lack of post-operative rehab and physical therapy, maybe even poor patient selection.
Okay.
There are factors including like the bone health, right? Other conditions like diabetes, obesity, of course, potential autoimmune disorders or osteoporosis. All these can adversely affect the outcomes of these total knee arthroplasties.
Well, and I can imagine that if you're not rehabbing the knee after you get it done, that it could probably become a little bit stiff and actually continue to cause pain. We've touched on this before when we did our segment about physical therapy, and I was telling you my experience because I've had 2 knee surgeries, first knee surgery versus second. First, I was young, didn't go to physical therapy, didn't think it was important, and I had pain for quite some time afterwards. Second surgery, I was married to you at this time. You really communicated the benefits of going to physical therapy, and I followed that, and I had a completely different experience. So is it the same when you're doing a knee replacement as well?
Sure. I think with any kind of joint surgery,
Okay.
the post-operative rehabilitation is incredibly important.
Okay.
What I tell patients this all the time, even with like spine surgery, for example, a little off topic, but
Yeah, it's okay.
you know, when you have spine surgery, you have new anatomy,
Mm-hmm.
right? And if you have spine surgery in your 50s or 60s, well, your body has gotten used to a condition for 50 to 60 years. Now all of a sudden you have new anatomy. You have to retrain the muscles how to work with the new anatomy that they've been given.
Okay.
And so that's where the physical therapy and rehab come into play.
got it.
Same thing with a knee replacement, right? Most people, by the time they get to the decision to make, you know, or to make the decision that they need a knee replacement, they're in so much debilitating pain that they're compensating.
Yeah.
They may develop muscle atrophy, imbalance in their body mechanics. Then all of a sudden they're given a brand new knee, but the muscles haven't recovered. Like there's no treatment surgically that's happening for the muscles, right? That's where the physical therapy and rehab come into play. And I think that can be daunting for some patients, but that's something that that definitely needs to be considered prior to undergoing that type of a treatment.
Right.
So when people have these knee surgeries and these replacements and they unfortunately don't do well or have persistent pain afterwards, which I see quite a bit of, I mean, that's why people come to me. You know,
Right.
the successful cases don't need to see me.
Of course.
I see the ones that aren't doing so well. And a lot of times they'll be referred from physical therapists
Okay.
who are working with them and saying, wow, you know, the pain is limiting this person's ability to progress in physical therapy. What can you do, right? Or surgeons say, hey, look, you know, this patient is 1 year after their arthroplasty and their knee looks great, the anatomy is amazing, but they still have this persistent pain. So one of the things I do, besides recommending more physical therapy, but
Right.
to control the pain, we can do this procedure called a genicular nerve block.
Okay.
So you have 3 main genicular nerves that provide sensation to the knee.
Okay.
So typically what we can do first is do this knee block.
And where are those nerves located?
They're located there's 3 nerves altogether. There's
Yeah.
one on the inside of the upper part of the knee, the outside of the upper part of the knee, and then the inside of the lower part of the knee.
Okay.
So that's where these 3 nerves are located.
Okay.
So under X-ray or ultrasound, we can go in and block these nerves.
Okay.
Right, and then that's just like we
That's
do.
fascinating.
Yes, it's
Yeah.
amazing. It's really great technology that we have available to us.
Yeah.
We shut these nerve signals off and see if the pain improves.
Okay.
Right, and so the criteria we look for is at least 50% pain relief
Mm-hmm.
for at least the duration of the local anesthetic that was used. So typically, I'll use a numbing medicine that lasts for about 6 to 8 hours.
Mm-hmm. Okay.
So during those 6 to 8 hours, we see if the patients get profound relief, and if they do, hallelujah. Pain comes back. Now what?
Yeah.
Well, the next step is to do a radiofrequency ablation.
Okay.
Now, we've spoken about
Right.
radiofrequency ablation in the past. We actually touched on radiofrequency ablation of the knee. But for people who have persistent knee pain after a knee replacement, this can be potentially a really good option.
And that's
So-
where you're just basically burning the nerves, right?
You can think of it like that, but
Okay.
what we're actually doing is using radio frequency energy, so radio
Okay.
frequency waves, right,
Yeah.
that are all around us, and we're concentrating that energy into the tip of a probe.
Okay.
That probe vibrates, and vibration creates heat.
Okay.
So we set our machine, the radio frequency machine, at a certain temperature. Once that probe vibrates and reaches that temperature, the machine will maintain that vibration at that temperature.
Okay.
What happens at that temperature is that the heat destroys the outer layer of the nerve.
Interesting.
So the nerve is still intact, but what we're doing, without getting too much into nerve anatomy,
Yeah.
we're just taking the outer layer of the nerve off.
Okay.
And so that's where the electrical communication
Basically,
happens.
like desensitizing
Exactly,
it.
or
Okay.
desheathing it, if you
Okay,
will. And so
okay.
there's a disruption between the knee joint, the nerve, the spinal cord, and the brain.
Okay.
And ideally, after this radiofrequency ablation procedure, people can get 6 months to a year of relief. And then during that
Wow.
time, ideally, they're doing their physical therapy and rehabilitating.
Okay.
The procedure can be repeated,
Okay.
usually every 6 months to a year.
And do
Just-
you see patients repeating it, or do patients usually after the first treatment and along with PT,
Mm-hmm.
do they find success and pain relief?
Some do, some need to have repeated
Okay,
procedures.
got it.
So, yeah. And those are factors we can't really determine. So those are very hard factors to predict. So some people may need repeated ablations. Some people one and they're good to go for several years.
Wow.
So,
That's great.
Yeah. So it's nice, really good technology that we have
Yeah,
available to
absolutely.
us. And that is a procedure that's covered by Medicare.
Okay.
So
And other insurance.
well, so that's where it gets a little tricky. Insurance
Okay.
companies consider this experimental, even though we've been doing this for 12 years now.
Okay.
And there's literature beyond literature that support this treatment for knee pain after
Okay.
a knee arthroplasty. It's something that I believe all private insurance companies consider experimental, so they won't cover this.
Okay.
But we
And
do
that's
offer-
something we can check for
for authorization.
patients.
Yeah, we
when
always check
patients
authorization.
call
There may
in.
be a plan or two that does actually cover this
Yeah.
procedure, but we also offer a cash pay option for
Mm-hmm.
patients if their insurance doesn't cover these procedures.
course.
But currently, Medicare is covering this.
Okay.
And this is the standard of care after a knee replacement. This is a procedure that's very, very common now.
Okay.
So,
Wow.
yeah, something to consider if you're out there and you have a knee replacement and you have persistent pain that is not getting better.
Yeah. It's fascinating. I feel like every time we talk, I'm just surprised by the information, and I just think how incredible you are and everything that you do in order to help patients live a pain-free life. It's pretty extraordinary.
Thank you. Do our
Yes,
best.
Of
Yeah.
course. Well, if you have any questions about this topic today, or if you've had a knee surgery and you're still not pain-free, you can always schedule an appointment with Dr. Goyle. All of our information is on our website, which is www.ispwscottsdale.com. You can also find him on social media, on Instagram at Dr. Ashu Goyle, and we're always posting different topics and trying to educate patients further on ways to improve their pain. Thank you for tuning in, and we look forward to seeing you again.